Hello, everyone. My name is Michaela Lopez.
Hi, my name is Emma Dillon.
Hi, Ms. Padilla.
And we are going to talk about the Clostridium difficile infections, also known as C. diff infection. Okay, there we go. So learning objectives. Hopefully after listening in our presentation here at the end that you would all understand the prevalence of C. diff infections, identify risk factors, symptoms, and preventative measures for C. diff infections. Also identify health resources available within the community and how they can benefit you. Lastly, understand Healthy People's 2020 goals in relation to C. diff infections. So what is C. diff? So Clostridium difficile is a bacterium. It's a life-threatening bacterium that causes deadly diarrhea and more serious intestinal conditions, such as colitis or the inflammation of the large intestine. It is also a side effect of taking antibiotics. So C. diff are commonly found in the environment, but most cases of C. diff occur while you're taking antibiotics. So our C. diff, how common are C. diff infections? So 13 out of 1,000 hospitalized patients were either infected or colonized with C. diff. This is according to the National Prevalence Study of Clostridium difficile in U.S. healthcare facilities. So CDI or C. diff infections appears to be increasing rapidly in the United States and is disproportionately affecting older people. According to the Centers for Disease Control and Prevention, more than 80% of deaths associated to C. diff occurred among Americans aged 65 years or older. CDC also estimates that C. diff affects as many as 500,000 people in the United States annually. C. diff is a major health threat. In 2017, there were an estimated 223,900 cases in hospitalized patients and 12,800 deaths in the United States. Next slide.
Okay, so C. diff symptoms are usually diarrhea, abdominal pain, or belly pain with tenderness, a fever, nausea, and loss of appetite. Okay, and the risk factors, C. diff risk factors include old age, 65 and older, recent stay at the hospital or nursing home, a weakened immune system, such as people with HIV, AIDS, cancer, or organ transplant patients, taking immunosuppressive drugs, previous infections with C. diff or known exposure to the germs. Anyone who takes an antibiotic is at risk of infection. All right, so to prevent C. diff, and nurses and other care providers, they must only give patients antibiotics when needed, clean their hands before and after caring for, put on gloves, and wear a gown over their clothing while taking care of patients with C. diff. Carefully clean and disinfect hospital rooms and medical equipment. Whenever possible, patients with C. diff in a single room or in a shared room only with someone else who has C. diff. Next. Ways to prevent C. diff infection is regularly clean areas of your home that may become contaminated with C. diff. Clean household surfaces such as countertops, sinks, bath doorknobs, and toilets regularly using warm, hot water with any household soap or any household cleaning products. Bed linens, towels, household linens, clothing, especially underwear. Okay, and here is a CDC poster on how to prevent C. diff. So the impact is in 6 patients who get C. diff infection will get it again in subsequent of 2 to 8 weeks. The risk is extended stays in healthcare settings such as hospitals, nursing homes increase the risk of C. diff. And how the spread is basically, it spreads through, it happens on, it can also happen when one healthcare facility fails to notify another and when they transfer a patient that has C. diff, so that happens. God, sorry, to find my screen. And how the prevention is basically we need to identify it right away, and wearing gloves and gowns, treating patients with C. diff, and remembering that hand sanitizer doesn't kill C. diff, so it has to be hand wash, a fully hand wash. And the resources, as you guys can see the links, these are the resources, Center of Disease Control, and there's additional resources as well. Emma?
Okay, and then some of the available health resources that we found, we had a little trouble with county, there wasn't much available. So these are some more nationwide things that are familiar. The Peggy Lillis Memorial Foundation, and that's they're building a nationwide C. diff awareness movement by educating the public and empowering advocates and shaping policies. So they're really involved with that if you check them out online. There's a C. diff Survivors Alliance Network, and they are dedicated to healing support for individuals that are coping with disease and the mental and emotional pain and alterations, and also dealing with the loss of a loved one as people do die from this. And then lastly, there's an online e-source network. It's called The Power of Poop. And that's basically where people can go to talk about their problems and battling C. diff. There was one success story on there about a man that for years was going undiagnosed and kept testing negative for C. diff. And so he has his whole story on there. And this was just a way to like open up about his story and feel comfortable about what's going on, since, you know, doctors see negative, they just rule out and say you don't have it. It ended up being that he did have it after taking an antibiotic of clemendicite. Can't even say it right. Can you say it, Michaela?
Clindamycin?
Yeah. Taking an antibiotic, and then that's how it all started. So that's really what it's common for. So, okay. And then the next slide. And then just a few statistics. Michaela kind of already touched this a little bit. It's one of the leading causes of infectious diseases and deaths in the US. It's affecting 100,000 nursing homes annually. 29,000 people have died or die within 30 days of being diagnosed. And then an excessive $4.8 billion spent in healthcare costs that attribute to cases of C. diff. And the next slide. And then how it benefits the community is basically how the CDC evolved. They're constantly supporting prevention and collaborating with prevention programs in states that have the high C. diff infection rates. It also involves working with healthcare facilities to identify and address barriers for diff. Expanding implementation of antibiotic stewardship programs in all healthcare settings, even to include dental offices and outpatient settings, and focusing on specific antibiotics linked to C. diff. trying to figure out like how it's being and what antibiotics are in these cases. And then using innovation to address critical questions such as the role of the asymptomatic carriers, transmission dynamics, patient's microbiome, and environmental cleaning. In our next slide. And then reflecting on this whole project, I think one thing that we all can agree on is that we really need to be washing our hands. As you see in the hospital clinical setting, nurses are going from patient to patient, and what's so important with this disease and to stop the spread is to wash your hands, like soap, water, scrub. The antibacterial stuff that's not going to work. You have to actually be washing your hands for 20, 30 seconds, because this is how it spreads, and it can be spread through spores and transmitted from patient to patient through the use of the contaminated equipment. So the nurse might spread it, from room to room by not disinfecting things properly. And our next slide. And then one other thing is C. diff, the next Healthy 2020, and currently it's not. We looked it up and it's not on the list of the Healthy 2020. Could it be for 2030 or the next round? And would be yes, because some of their goals on here, as you can see, is achieving health equity, eliminating disparities, improving the health of all groups, creating social and physical environments that promote good health for all, promoting quality of life, healthy development. And yeah, I mean, C. diff, it's affecting enough people. There's support groups out there. So I definitely think that it does fit that, and it could definitely be on the Healthy People 2020 or 2030 as we move forward. So that is our presentation. Thank you for learning about C. diff today.
Thank you.
Thank you.